So thank you, David, for allowing me to show the before and after on the full face. But before David shared his experience with the audience, I'm gonna show the audience what David looked like. And this is just 6 months, and in a year time he's gonna have full set of hair. But he has such a great growth that you know, it really changed him. And I'm happy to be a part of bringing back his handsome face and his look. And that's 6 months. And but you know, the pictures speak 1,000 words. That's why it is before. So, okay, now I'm gonna have the audience all yours. So why don't you start at the beginning, how hair loss affected you and your research and surgery day and recovery, okay?
So currently right now I'm 27. I just turned 27, but when I was around 24, that's when I started noticing the hair loss. And that's when I started looking into, you know, hair loss treatments and stuff like that. And it took me, I think, about a year and a half to really find you. And like I did a lot of research, watched a lot of videos. So I pretty much did everything that I was supposed to do, you know. And during that time, I was also saving, you know, for the surgery because.
It's not cheap.
It's not. It's honestly, it's not cheap, and
right.
especially if you want to do it in the United States, it's very. It can be pricey, and I didn't really want to travel. You know, go overseas somewhere that I wasn't comfortable with, or because I knew the procedure was the recovery was you know it's a long process,
right?
And I don't want to be stuck in a different country, and you know, God, who knows, you know, what could happen, you know, just because. Just because you wanted to save a couple $1,000. So I just wasn't comfortable with the whole idea. So that's when I found you, and then I came in for a consultation, and you were pretty honest about everything. You know, you told me straight up, you know, this is how much grafts you need, and this is what I can do for you. And from there on, we just, you know, we made it happen. You know.
Sure. So I guess the other video from the other patient really helped you, and that's why you decide to.
Yeah,
your
and then
face to help other people as well.
Yeah, and you told me that because you mentioned you have a lot of videos on YouTube, so I started doing research and watched a lot of your clients, and there was one particular client of yours that came in once a month.
Chris.
And yeah, Chris. I started watching his video a lot, you know, and just seeing the overall transformation. You know, he was completely. Bald in the center, and you know, he almost had the same graft as mine, and that was just a total excitement for me, you know. So yeah.
Okay. Can you share the audience what's it look like on surgery day, if you remember, and then what's the recovery like, and when the hair start going out for you?
So before the surgery, it was just normal. Everything was normal. I didn't really you know, get into a whole lot of preparation. You know, I just showed up, had someone drop me off, and came in, and it was pretty simple. It was painless, you know. I didn't feel a thing. All I know was I just passed out and woke up and all set to go home. So, and then the recovery afterwards was it was a little bit long. You can say that.
Yeah.
And I took 2 weeks off from work, which helped me out a lot.
Yeah, most people take around 1 or 2 weeks and to recover, you know, and some people might be shorter, some people longer, but the swelling, right, and the swelling disappear about a week.
Yeah.
And and when did the hair start falling off for you, and when did it start regrowing?
After the first month. The first month, I started noticing, you know, one by one, you know, they started falling, and it wasn't. I mean, at first it was kind of
stressful.
It was a shocking moment, you know, seeing all the hairs, you know, because at that moment you're thinking, oh, did you do something wrong? But it's just a process. It's just a process. It takes a long time, but I think it was definitely worth it. So.
Sure. And when did the hair start to come back? Would you say 4 months, 3 months, 6 months?
No, not even. For me, I started noticing results after the 2.5 months.
2 months. You were just taking off fast, huh?
Yeah.
Did we do ACell or amniophil, or did you do both of that? Do you remember?
I think we did the ACell before.
Yeah. Okay.
Um,
Yeah, I believe we did.
and then I started taking Propecia and also using Rogaine.
That helps.
After the once the hair everything started falling. Yeah.
Because medicine by itself is not gonna grow out this kind of result.
Yeah.
You know? And so once you have surgery, medicine help maintain. You know, and you spend a lot of money. You want to make sure you maintain your result. You know.
Yeah.
So that's good. And so did people make any comment about your new handsome face?
Definitely. Especially at work. I work out. Also, another thing too. I work out once every other day, pretty much 4 or 5 days a week. And I work out for like an hour and a half or two. And that was also a big change for me because I had to take a month off from the gym. That's something that I didn't see a whole lot of videos on YouTube or anything like that. So I just wanted to point it out that for people out there that that work out and they want to do the procedure and they don't they don't know how to go about it. I was fine. I stayed home for the first 2 weeks, and then after that, I waited another 2 weeks until I hit the gym, and I was totally fine. Just don't stress it. Just take the doc's advice for it, and just do whatever. I did all your recommendation, and I follow your rules, and it's paid off.
Did people ever say you look like Zane?
I do. Yeah.
You have a similar feature. I mean, both you guys are very handsome and have nice dark hair, good feature, and hair transplant can do that. And Zane has a little bit lower hairline. If you ever Google his look, and so if you ever change your mind, decide you have lower hairline like him, you let me know and we can make it work. And stay tuned. I'm excited for David because you bring back the handsome face for him. He already has a handsome feature, and what hair transplant does is it enhance it and bring it back. You bring back your look and your youth and your look, and as long as you do it right, there's a whole artistry behind hair transplant too. And so you don't just throw it in, and if you do it too high, you're gonna have hair and you're gonna be happy, but not 100% because it draws attention. If you look at some politician, they did a hairline very high and straight. I just can't name the name, but anyway, so you don't want to do that, and you don't want to do where it's not proportional. So you want to make sure it's very proportional, not just vertically, but horizontally as well. But with your feature and your face, I can pretty sure I can lower that a little bit more to make it more perfect. I'm a perfectionist myself, so and so stay tuned. We're gonna do a year follow up with David.
Definitely.
All right, thank you for the audience, and we'll stay tuned.